Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 17-year-old male is reviewed 6 weeks after starting an oral antibiotic for acne vulgaris. He stopped taking the drug 2 weeks ago due to perceived alteration in his skin color and denies being exposed to strong sunlight for the past 6 months. On examination, he has generalized increased skin pigmentation, including around the buttocks. Which one of the following antibiotics was he likely to be taking? A. Doxycycline, B. Oxytetracycline, C. Tetracycline, D. Erythromycin, E. Minocycline. Okay, this patient is coming with the complaint of skin discoloration due to a use of antibiotic. And the minocycline can cause the discoloration or skin discoloration or pigmentation change in the patient. Here we are going to explain it. Minocycline is an oral antibiotic from the tetracycline group. Minocycline stops bacteria from multiplying by inhibiting protein synthesis inside bacterial cells. Binds to the 30th ribosomal subunit of bacterial ribosomes. This meaning blocks the attachment of aminosyl tRNA to the acceptor site on the mRNA ribosome complex. As a result, peptide elongation is inhibited, so bacteria cannot make essential proteins because it stops growth rather than directly killing bacteria. Minocycline is a bacteriostatic, not a bactericidal. It's a bacteriostatic antibiotic. Note, minocycline can cause irreversible skin pigmentation and is now considered a second-line drug in acne vulgaris. Uses of minocycline acne vulgaris in moderate to severe cases, rosacea in some cases, respiratory tract infection, urinary tract infections, and some sexually transmitted infections, example chlamydia, and certain skin infections caused by susceptible bacteria. Common side effects of minocycline: nausea, vomiting, diarrhea, dizziness, lightheadedness, vertigo, skin rash or itching, and photosensitivity, increased risk of sunburn. And this patient is saying that he was not exposed, he has not long exposure to the sunlight. And this question want to say that this is not a photosensitive rash. Okay, photosensitivity, increased risk of sunburn. And serious but less common side effects: hepatitis or liver damage, autoimmune reactions, drug-induced lupus and autoimmune hepatitis, skin pigmentation changes. And this is important, as we can see this one in our patient. Skin pigmentation changes, bluish gray discoloration, especially with long use. Bluish gray discoloration is their side effect of minocycline. Hypersensitivity reactions and pseudotumor cerebri, increased intracranial pressure, and this is a very important side effect of minocycline. Precautions not usually given to children under 8 or pregnant women can cause a permanent teeth discoloration and affect bone growth. This is also very important note. Take with plenty of water and avoid lying down immediately after to reduce the risk of esophageal irritation. Use sun protection during treatment. As we said, it can cause skin irritation in sun exposed areas. Here we can see the discoloration of the face, tongue of the patient using minocycline. Here we can see also the discoloration of the neck of the patient using long-term minocycline. Here we can see their complete discoloration, bluish gray discoloration of the face of the patient using long-term minocycline. This was a short explanation about minocycline and its side effect uses and side effects. Thank you for your attention.